have immediate access to emergency counseling services 24 hours a day, 7 days a week by calling 1-800-273-TALK. That's 1-800-273-8255. Did you know the Michael King VA Medical Center has a website with eligibility and enrollment information, details about VA healthcare programs and services, and important contact information? Find all at www.houston.va.gov. Can't make your next VA medical appointment? If you can't use your appointment time, another veteran might be able to. Call the VA Network Healthcare Center at 713-794-8985 to cancel or reschedule. The easiest way to get your prescriptions refilled is to call the automated pharmacy refill line at 713-794-7648. Make sure you have your social security number and your prescription number handy when you call. Have a medical question on the weekend and not sure who to call? The VA Network Healthcare Center is open 24 hours a day, 7 days a week, and can be reached by calling 713-794-8985 or 1-800-239-5137. Talk with experienced and knowledgeable healthcare professionals and get answers to your medical-related questions. Want to find out about available VA healthcare benefits and services? Next time you are here, pick up a veteran information packet at the information desk. You can also call 713-794-7349 to have one mailed to you. If you are recently discharged from active military duty with services, okay, sir. So, how would you like to be able to use that?
Well, I've told you the situation, ma'am. I don't know. I need an effective caseworker. I know it. I know it. It's because every time I talk to somebody down there and they say they're going to help me, they never help me and nothing gets done. And all this stuff is built up to now where I'm so sick I can't hardly get around. I need help doing everything and they're not helping me do nothing down there. I need help finding a handicap accessible apartment. And I need to help find a doctor that can help me, that can tell me what's wrong with me and have a plan of action. There's no plan of action that I know of. Is there some continuity of health care, somebody down there that can help me? Help me. I'm supposed to have veterans homeless program, and I'm supposed to see doctors down there that help me, and I'm not getting that. So I need to get into a new clinic and see a different doctor that might be able to help me, and I need a caseworker that knows what they're doing and is going to help me, and I need to find a place to live.
I cannot overstep on your case manager. All these requests need to go through her.
I have requested it through her, ma'am, and she won't do it. She tells me she's going to do stuff, and she never does it. I told her the day I went and filed that application at that other apartment complex, I had to go there and to the doctor, and I said, there's no way, after sitting up here for 2 hours filling out this application thing, that I can make it to the VA. And she said, don't worry about it. I'll call over there and talk to the doctor, and we'll cancel that appointment. And she didn't do that. The appointment shows up as a no-show. She was supposed to call over there and cancel it. She didn't do anything she says she's going to do. So I don't know what to tell you.
Do you want to talk to the supervisor? Do you want to talk to hospital administration? What do you want me to direct you to?
Yeah, I mean, I've tried, to get to work with this Tony Brown, and that's not really worked out either. So, who do I need to go to? The patient advocate? I've tried to contact the chief of staff over there about my medical care, and they won't even talk to me over there. I asked them to have the guy call me back, and they said he won't call you back. You got to go to the patient advocate over there. And I've gone to the patient advocate. I've written letters to my congressman, and the letter that I got back from the hospital had said nothing about my complaints. You know, it says he's got some shoulder problems, and we sent him to a doctor, was a physician's assistant, gave him some injections in his shoulders and did MRIs, and the MRIs are clear. They did no MRIs of my shoulders. They did MRIs of my back, but not of my shoulders. And that's all that was in the letter. It said nothing in there about this casework problem that I'm having with the housing people. It said nothing about this problem with the pain management doctor down there. It didn't address any of those issues. It just said something about my shoulders, and that was it. So, you know, I guess I need to go to Mr. McDonald's office or something, that somebody higher than the VA at Houston, because I keep getting sent down there and nothing ever gets resolved. You know, nothing. I just keep getting sent back and forth and back and forth, and you know, there's no plan of action. There's no nothing. I don't have an appointment to see a doctor to follow up on my physical therapy. I don't have an appointment to see a doctor about my back and my neck. I need to see a orthopedic specialist. I need to see a neurosurgeon or a neurologist. And I was supposed to be getting a wheelchair down there, and my doctor made a consultation for me to see the wheelchair people, and it got canceled 2 or 3 days before the appointment. They canceled it. And my doctor can't even give me a diagnosis or tell me, you know, what's wrong or what's going on. They don't even know. After seeing me for 4 years, she don't have any idea what's going on. So, you know, you tell me who do I need to talk to?
You can Tony Brown, health supervisor. You can contact the hospital. You can contact the patient advocate. All that information that was missing in the last letter, you can write it down and put it in any letter that you want, and you can send it off from there.
Who do I send it to?
Whoever you want. I mean, like I said, you can do patient advocate. You can do it to Tony Brown, supervisor. You can do. I mean, you can send it to whoever you would like. The hospital administration, wherever you want to send it to.
It was sent to the hospital administration. Mr. Walma sent a letter back that said nothing about the complaints in the letter. It was just some short, vague thing about my shoulders, and that was it. I mean, that's who's the next step up then above the regional VA hospital? What's the next level up? Is that Mr. McDonald's staff? That how do I get a hold of Mr. McDonald?
Chain of command and leave it to the website?
I have not.
Okay, I don't know offhand. I'll have to see.
Because sending me back to the people that aren't helping me in the first place is not. That's why this problem is happening, because they just keep sending me back to the same people, and it's not getting resolved.
You're just not being patient, sir?
Well, how long do I have to wait, ma'am? 6 years to get somebody to help me with my back? I've got.
As far as I understand, they're working on it. As far as the housing issues are concerned, they're working on it.
Right, and the housing issues that they're working on now were caused because the housing issues that they were working on last year didn't get worked on, and now they didn't get worked on this time because I'm fixing to. My lease is ends the 31st. Housing says I got a month extension, but they said 6 weeks at the place that I found over there before they'll even take my application again, and that takes a week to process. So I've been patient, ma'am. I've been patient. I've waited. I've asked for help. I was supposed to be getting help from these people. You know, I asked for somebody to come give me home health care. They put in a consultation. It got approved. It took 3 months after it was approved before anybody showed up to help me. You know, and the caseworker came into my house and saw how bad it was and never said nothing about it. I mean, it's nothing. And you're telling me that I'm not being patient?
No, I'm telling you, I'm suggesting that you be patient.
I've been patient, ma'am, and that's why I'm so frustrated, and I'm afraid because I'm in the same situation I was in last year with these case managers supposed to be helping me. And she's not helping me. She's supposed to be talking to my landlord. I don't think she's ever talked to my landlord. You know, I was supposed to be coming over here once a month. I was over here for 3 months, and then before they ever showed up for the first time. You know, and I told him then that this is not working. This is not a good place for me to be in. I have no quality of life. I can't go outside. I can't get off the sidewalk with my wheelchair. I can't get around this place. It's unsafe. The cops are always coming over here because of gunfire, and people have stolen stuff from me already, so I can't, you know, let anybody in my house over here. I'm just here all alone all day, 24 hours a day. I just sit here in this house by myself. You know, cause of what they put me over here in such a. This is the place, the VA. They put me over here in the last minute because we ran out of time. Because I had been patient. I had been patient, and I trusted my case manager, and he kept telling me he was working on it, and kept telling me to hold on, and then it all the time just evaporated, and they just had to put me over here because it's the only place they could find in such a short time. So I don't have no plan of action. Got my doctor's office down there. My physical therapy's been over for over a month. You know, I don't know what's the next step with that. I don't know. I don't know what's going on with anything down there. So I mean, if you can't help me, then I guess the patient advocate, maybe they'll know how to get a hold of this McDonald guy's office.
To find out about available VA healthcare benefits and services,
Oh God.
next time you are here, pick up the veteran information packet at the information desk. You can also call 713-794-7349 to have one mailed to you. If you are recently discharged from active military duty with service in a theater of combat operations, VA can provide you free medical care for 5 years from your discharge from active duty for conditions possibly related to your service, regardless of your income status. For assistance, call 713-794-7034.
What do you want, boy?
Not sure what medical benefits work.
Oh.
At 713-794-7288. Volunteers are an important part of the VA healthcare
Oh.
system. To find out how you can be a part of the volunteer team, contact the volunteer office at 713-794-7135 or stop by room 2A104 on the second floor. Forgot what your next appointment is? Call our automated information system at 713-794-7648 for a list of your future appointments. Please let us know when you move or change your telephone number. With this updated information, we can be certain you receive your medications, appointment letters, and other important information in a timely manner. You can now refill your prescriptions online. It's fast, easy, convenient, and secure. Visit www.myhealth.va.gov on the web and register today. Veterans experiencing emotional and suicidal crisis and their concerned family members or friends have immediate access to emergency. Hello, sir. I'm back.
Okay.
Okay. You have a minute to work?
Yes.
Okay. Extension 27884.
Okay.
That is patient advocate.
Uh-huh.
Please direct all issues there.
Okay.
Have help them help you resolve those, okay?
Okay.
Okay.
And who are you?
My name is Erica. I'm a social worker with the Homeless Veterans
And you work in the Veterans Homeless Program,
Yes, I do.
and you can't help me with any of this.
Well, what of that would you like for me to help you with?
I need to have this issue over there at this last apartment resolved, and I need it.
Manager for that, and I will give her a call and let her know that.
Well, I mean, you know, she went over there with me, and we didn't have enough money to pay the balance that was due, and
I see that she's already documented that she had one of the agencies pay towards that balance already.
right, but it wasn't enough. It was
Okay,
it was
so-
it was $200. It wasn't $100.
So, I
But
think
she didn't know that because she's not working on it. She didn't call over there and talk to him and find out what the balance is. I thought it was $100. I don't know how it ended up $200. I need somebody to help me with these things because I'm sick. You know,
that's what the case manager's for, to help me work on those things.
and then why didn't she know what the balance was over there? Why is there a balance? Huh?
Did you know what the balance was?
I thought I did.
Okay. Well, she expects those things to come from you.
Well, she's supposed to be involved with this. She's supposed to be talking to these people, but she's not talking to them. And I'm sick, ma'am. I can't do it. Right, but I'm not able to manage these things. I can't manage them on my own. That's why I'm supposed to be having her help me. But she didn't have any of the information that she should have had to go over there.
I think she's doing a lot for you. It sounds like it. If she went over there and you could, then it sounds like she's trying to reach the applicants on behalf. Maybe she's not doing it the way you would like for her to do it, or maybe not as quickly as she wanted to be done, but she's trying.
She's been trying, ma'am. I've been living here for a year, and they're supposed to have been helping me find a handicap accessible apartment, and that's not happened. I'm not even moving into a handicap accessible apartment.
Okay, so you have internet.
I sometimes I do, sometimes I don't. It goes in, it goes out.
Then you can do that online. You can help her with that task and help her try to find a handicap.
There's supposed to be a housing specialist in your department that helps us with that. I have called people and I have called people and I have called people, and they all tell me the same thing. You know, they don't take Veterans Choice Program, they don't take vouchers, or, you know, that's seniors only. The one place that they told me that I could go to, I would have to give up my voucher to move there because it's under some other program. And what happens if that doesn't work out? You know, then I don't have anything. They're supposed to be helping me, and here I am fixing to be with my lease over and nowhere to go to. You know, there's no second choice. There's no other plan. The plan is to do what I did the last time that put me in this situation in the first place. You know, it was nothing that I did. I paid my rent. You know, I relied on the case manager then to be helping me, and he didn't help me. He just told me he was helping me, but didn't help me. If they were helping me, I wouldn't be in this situation. I'm not reliable. I can't manage these things in my head. I can't do all the things that I could used to do. That's why I'm asking the VA to help me, because I can't do it on my own. And the case manager's supposed to be helping me. She's supposed to be in touch with my landlord. It says in the thing they're supposed to talk to the landlord, you know, once a month on the 10th when rent is past due to make sure everything is going okay. You know, I bet she's never talked to this landlord over here. You know, they're not involved with my casework like they're supposed to be, or I wouldn't be in this situation. I've had a caseworker over there for 4 or 5 years now, you know, and now I'm having to move again within a year because they put me over here. And you're telling me to be patient, that they're helping me?
So I gave you this number to the patient advocate. Anything else I can do to assist you today?
There's nothing that you've done to assist me today. But give me the number to the patient advocate. I mean,
You're right. I can't fix anything over the phone for you. So if anything you would like for me to do, I need to call.
no, ma'am. that I can't do that. I'm stressed out and I can't sleep because I'm worried about all this and my back is hurting. So just hung up on me. Okay. Oh. Oh wait. There, that's the one. What is it? 27884.
Let us know when you move or
I didn't do 27884. Dialed the wrong number.
VA Medical Center. One moment, please. 273. Talk. Welcome to the Michael E. DeBakey VA Medical Center in Houston, Texas.
Just rolls back
If you are
over.
having a medical or mental health emergency, hang up and
27884. It's the physician advocate, patient advocate.
Welcome to the Michael E. DeBakey
I'm
VA
not
Medical
answering
Center
down
in
there.
Houston, Texas. If you one moment, please. With experienced and knowledgeable healthcare professionals,
This is not recording.